Hello, I'm the ASMR psychologist. Welcome to my channel. Now, today we're going to be doing an anxiety test. Now, this test will help you to work out if the symptoms you are experiencing are in fact anxiety. And if the problem turns out to be anxiety, how much of a problem that actually is. So, the test has 20 questions, or statements, I suppose. And I'll ask you to rate each statement on a scale of 1 to 4. 1 being a little bit, 4 being a lot. And then at the end I will get you to tot up your scores and I will show you how to interpret them and then what to do with the interpretation. So, unless your mental maths is superb, you might want to get a piece of paper and a pencil. Okay. Before we start, if you like this type of video, this kind of testing video, and I know I haven't done one for a while, so if you do like them, let me know by giving me an up thumb so I know to make more. And if you're not already a member of my community, maybe you will consider joining me by subscribing and of course hitting the notification bell so you don't miss anything good. Okay. So if you have your piece of paper and your pencil, let's begin. Question 1. I feel more nervous and anxious than usual. And I'd like you to rate that on a scale of 1 to 4. 1 being a little, 2 being some of the time, 3 being a good amount of the time, and 4 being most of the time. Question 2. I feel afraid for no reason at all. On a scale of 1 to 4, How does that apply to you? Question 3. I get upset easily or feel panicky. Wonderful. Question 4. I feel like I'm falling apart. I'm going to pieces. Question 5. I feel that everything is all right and nothing bad will happen. On a scale of 1 to 4, 1 being a little, 4 being most of the time. Question 6. My arms and legs shake and tremble. Question 7. I am bothered by headaches, neck and a back pain. Question 8. I feel weak and get tired easily. Question 9. I feel calm and can sit still easily. Question 10. I can feel my heart beating fast. So we're halfway through. Sometimes when we are doing something that has been labelled a test, it can be easy to get tangled up in what's right, what's wrong. So as much as possible, just try and answer with your heart rather than your head. This is just a starting point for understanding what's going on for you. Okay. Question 11. I am bothered by dizzy spells. Question 12. I have fainting spells or feel like it. Question 13. I can breathe in and out easily. Question 14. I get numbness and tingling in my fingers and toes. Remembering the scale 1 to 4. 1, I'm bothered by stomachache or indigestion. Question 16. I have to empty my bladder often. Question 17. My hands are usually dry and warm. Question 18. My face gets hot and blushes. Question 19. I fall asleep easily and get a good night's rest. And finally, question 20. I have nightmares. Okay, so now you need to tot up your scores and then we'll interpret them. Okay, make sure I give you enough time. I'm very slow at things like that. Okay, so what I'm going to do is, and if I forget please remind me, but I'll try and remember to put the link to this test in the description, so if you want to find out more about it, you can. It's a test that's been quite well researched for this purpose, so if you're interested, I'll put the link there for you. Okay, so now you've got your score. Let's interpret it. So if you scored between 20 and 44, you're in the normal range. 45 and 59, the mild to moderate anxiety range. 60 to 74, marked to severe anxiety range, and 75 or above, the extremely anxious range or extreme anxiety range. So if you're taking this test near to the recording date, which is, gosh, I don't actually know what the date is, but it's towards the end of April 2020, it's probably worth taking this again in a few weeks' time, once the world has settled down a little. But then, these are the things to consider. So, anxiety, up to a certain point, is very important. It's pivotal to our survival. serves a vital function. It helps us to prepare and to tackle challenges, to respond when we need to. So a certain level of anxiety is required, I suppose. But if you are consistently scoring above the normal range, then your anxiety has tipped over into a place where it's more of a hindrance than a help, and it's important to do something about it. And it's important for a few reasons. Firstly, because you deserve to feel better than you do. But also, anxiety, although very, very common, as that anxiety above the normal range is very, very common, it's such an easy problem to resolve with the right techniques, so there really is no need to suffer. No need at all. In the first instance, I think that videos like this, ASMR videos, and you find the ones that work best for you, can be amazingly helpful in calming you down. ASMR has quite an immediate impact. But of course, as you know, if you listen to a lot of ASMR, it doesn't actually help us to resolve the difficulties that underlie our symptoms. So outside of watching the videos, our symptoms usually return. But it's a very good day-to-day way of coping. I think, though, that you do need to combine it with strategies that help you to resolve what underlies the difficulties. So, psychological strategies, and if you watch this channel a lot, you'll know that we do a lot of that on here. If you want to specifically address your anxiety, I would suggest my Psychologist Roleplay series. And the reason for that is it draws very heavily on a therapy called cognitive behavioural therapy, or CBT. And currently research suggests that's the most effective treatment for anxiety. Increasingly, I am recommending to people that they combine ASMR, even if they don't get tingles, with cognitive behavioural therapy, because although, let's call it CBT, it's less of a mouthful, because although CBT is very, very effective, it doesn't work immediately. You have to learn various skills and strategies, and like any new skill that you learn, it takes a while to get the hang of it and for it to have an impact. So I think if you are using or listening to ASMR videos whilst also learning CBT strategies, it tides you over. I think that in the past that's been the hardest thing in my work, is presenting this amazing treatment program to people, but then saying that it's not going to help them tonight, or maybe for a few weeks to come. So I think if you've discovered that anxiety is a problem for you, you need a two-pronged approach or attack. In the short term, continue to use your ASMR videos to soothe you, help you to get to sleep and bring down your anxiety across the day, but then begin to explore CBT either through my role play or elsewhere. There's lots of information available online, or maybe if you feel you need the extra support, get yourself a therapist who specialises in that treatment method and work on the factors that underlie your anxiety. Because I guess it's important to say, anxiety doesn't strike randomly. There will be an underlying cause that you can address to bring yourself some longer term relief. Okay. So, I guess that's it for today. I hope it was helpful. And I will see you soon.